I'm here today to talk about my perspective of stroke. Before I was a stroke survivor, I thought that I know everything about stroke as a neurologist, but I was so wrong. I mean, after being a stroke survivor, I think now I understand the things about stroke. Before being a stroke survivor, I might have read about stroke, maybe in total, med school, residency, fellowship in total for maybe 500 hours or maybe 1,000 hours. But then since September 24, 2019, I am living with a stroke 24/7, 365 days a year. I've noticed so many things, and it has completely changed my perspective and even completely changed my practice as a neurologist. So I would just like to share that with you guys. So the objectives for my talk is to discuss how stroke can affect an individual, the family, and the community, and what are the commonly unrecognized signs and symptoms of stroke. We all know the commonly recognized ones: weakness, numbness, dysphagia, dysarthria. But then there's a significant one that is an under-recognized and underserved symptom of stroke, and that is where I would like to pay my attention. And then common misconceptions people have regarding the recovery of stroke, and what can we do to limit all these gaps in just general knowledge for patients or stroke survivors, and what my experience has taught me. So, briefly about my experience, I had a stroke, a hemorrhagic stroke in September of 2019, and that made me completely hemiplegic or weak on the right side of my body and aphasic. So, I lost my speech ability, and it took me a long time to recover. I mean, I'm still recovering. I was in a wheelchair and completely bedbound, so to say, even though I was in inpatient rehab and all those things. But I was in the wheelchair for 4 months, then gradually started walking with a cane and then independent. I still have a foot drop, so I still have certain limitations. My right hand, and I was a right-hander. I mean, I am still a right-handed person, but now I've learned everything with my left hand. But I was a right-handed person, so my right hand is still not functional. My speech, it's definitely 95% better. But here's what I do. I usually, if I'm not able to speak or if I'm stuck at something, I blame it to the aphasia. Nobody would know that that is because of I'm less prepared or something. It's me. I just blame it to the aphasia. Actually, now I'm more confident in public speaking than I was before because now I have this aphasia to blame on. So it's not me, it's the aphasia kicking in. And then one of the big things that inspired me to spread awareness is my recovery was full of emotional or mental health challenges to an extent that I wanted to just take my life. I did not do that because obviously I had good family support. And then moreover, I wanted a foolproof mechanism. I did not wanted something that would leave me with more brain damage, because being a neurologist, I've seen patients with suicidal attempts and then they are in more brain damage. So, but then, yes, more than that, my family, I had great support. I took care of my mental health, realized that it's okay to be depressed. It's okay to be anxious or not able to cope with things. It's just not for stroke, but just for any chronic medical condition. I usually joke with the patients now that even Elon Musk or who's the other guy? Well, even Elon Musk is not completely happy. I'm sure he also needs a psychologist or a therapist. So that's about me. Let's start talking about what is a stroke. So it's a life-threatening condition, which is damage to the brain because of blood vessels which are supplying oxygen and nutrients to the brain. And it's the leading cause of disability here in the US, vessel of the brain. The second one is hemorrhagic stroke. That is the kind of stroke I had. This is because of rupture of a blood vessel in the brain. The most common structure or the most common blood vessels that can rupture is so an aneurysm or arteriovenous malformation. So here in the diagram, you can see that there's a small aneurysm and it ruptures because of the weakness in the walls. And then the third one, which is, I think, the better one, and all the four different types of stroke is TIA or transient ischemic attack, also known as warning stroke or the mini stroke. In this, the symptoms could be the same as stroke symptoms, but they are short lived, maybe a few minutes to a few hours, and with no damage to the brain. But these are the important ones to be taken care of because a person who's had TIA is at a very high risk of having another recurrent stroke. So, if anyone you know has symptoms of stroke, be fast. That's another acronym that you are probably listening to these days. Any symptoms which make you feel that a person is having stroke like symptoms, call 911 and get emergent medical help. And then there's another category or another type of stroke, which nowadays we are labeling as a cryptogenic stroke, or basically fancy way to say that we don't know what caused your stroke. So this is about one third of ischemic strokes are labeled as cryptogenic, that we don't know what caused your stroke. I mean, they have extensive workup done and still the cause is not found. So we don't know if we need more workup or what is the cause, but yeah. So this category, cryptogenic stroke, is kind of a dangerous zone to be in because 1 in 4 stroke survivors will have a repeat stroke. So just talking about the statistics now for stroke. So each year here in the US, there are 800,000 strokes per year. And to make this number more terrifying, every 42nd person has a stroke. A stroke occurs every 40 seconds. And 1 in 6 people will experience a stroke in their lifetime. And about 3/4 of these are new strokes, but then 24% are a repeat stroke. So at least 1 in 4 people will have another stroke or have had a previous stroke. And as I said earlier, stroke is the number one cause of disability in the US. It's the leading cause of immobility in any stroke survivor above the age of 65. And to continue the statistics, as I mentioned again earlier, that like heart disease and stroke, they claim more lives than cancer and even chronic lower respiratory diseases. And stroke, again, is the fifth most common cause of death. And so, just to make this number also more terrifying, almost every 3 minutes, there is a death because of stroke. And then now briefly talking about the gender and race. So women are more prone for stroke. Most of the studies say that it is hormonal. So they are more prone for strokes during pregnancy or peripartum, postpartum. Then if they have preeclampsia during pregnancy or if they are on birth control or any kind of hormone replacement therapy, and if they have migraines with auras and they are a smoker. So that's a big no-no for women with migraines with auras to be a smoker because that puts them at very high risk of strokes. And then strokes are more common in African American. So that makes it, if you are a woman and African American, that just puts you at more risk for stroke. All right. But here's the most important thing. 80% of strokes are preventable. Just looking at this number, I mean, Come on, right? 80%. So how can we make it better? I'm not going to go into all the details, but American Heart Association, they have life essential 8. So the first one starts with eating better, and then be active. So American Heart Association, they recommend being moderately active, like going on walk or anything. They're not asking you to run. Moderate activity of 150 minutes a week, or vigorous activity of 75 minutes a week for uh, runners and other more intense exercises. Manage your blood sugars, your cholesterol, your blood pressure, manage your weight, and then quit tobacco. Yes, of course. And then get healthy sleep. So, an average adult needs about 7 to 9 hours of sleep. And actually, there was a paper published, and it's on American Heart Association, which says that people who have insomnia, they can have about 54% higher risk for stroke. So all these, that's what American Heart Association is labeling it as life's essential aid. So these are the common symptoms of stroke: weakness, numbness, dysarthria, dysphagia, aphasia. I mean, these are all the common symptoms. But the other signs and symptoms which a stroke survivor will not come and complain or report to you: bowel and bladder problems, like, for example, urinary retention, bowel retention, stiffness and spasticity. About 25% of stroke survivors, 25 to 40% of stroke survivors have stiffness and spasticity in their first year of being a survivor. And then sexual problems, they have erectile dysfunction and other problems, which affect the quality of life, which affects mood. But then nobody is going to talk about these symptoms. I don't think even I ever asked a stroke survivor earlier that, are these problems going on? Are you having any bowel or bladder problems? Are you having any erectile dysfunction or some other sexual problems? But then, yes, these things, they affect the quality of life. And then fatigue, obviously, sleep problems. But my main focus today is to talk about personality changes or mental health changes. So, stroke can cause several mental health changes. Depression, that's one of the most common one. Literature says that about 30% or one third to half of stroke survivors can have depression, and anxiety runs hand in hand with depression. And I was, or I am, one of that one third or one half of the stroke survivors. And then pseudobulbar affect, which is also called as emotional incontinence. That is where it's sudden outbursts of laughter or crying in an inappropriate setting, post stroke depression. So it is largely unrecognized and undertreated, underserved, underdiagnosed symptom of stroke. About one third or 30% of stroke survivors are affected by stroke, depression, and anxiety. And it can occur at any time. It can occur immediately after stroke. The highest or the peak prevalence is reported in the first few months, about 3 to 6 months, with a still high prevalence in first 3 years. But it can happen anytime. Anytime, maybe 5 years, you are okay with the first 5 years, and then 5 years down the lane, yes, you can develop symptoms that are concerning for stroke. And then obviously, so how does depression affect a person? It does affect the quality of life, but then, yes, I mean, if I am depressed, I would want to just sit and have apathy or lack of interest, and I would not want to participate in my therapy. I have been in that stage that, yeah, I mean, my family used to be after me, and I was like, why are you guys on my nerves? I don't feel like doing it. I don't want to uh, do therapies. But then, yes, so the underlying cause could be the mood problems. And then, of course, it can cause cognitive dysfunction, or cognitive impairment, and then increases mortality and suicide rate. And of course, it imposes a heavy burden to family as well. So these are the common symptoms of depression. So the most common is, again, depressed mood, which is anhedonia, or lack of interest in the activities which you used to love. Now, there's a tricky way to ask the patient. So if a patient was used to, let's say, bike ride. So like for me, I used to run and bike before my stroke. But then after the stroke, yes, I cannot do that. So if my doctor would ask me, does biking gives you pleasure? I was like, hell no, I cannot even get onto a bike. So you have to find activities which the patient, the survivor can do now, and maybe just simple thing like, do you still enjoy watching TV or watching the shows or whatever things the survivor can do now? This is very interesting. So, the etiology of post stroke depression. So, most people think that it is because they cannot do what they were able to do earlier in life. Now, with stroke, they cannot do that. Yes, that is one of the reasons, but that is not the entire reason.